I often say bloating is not the enemy. Bloating is actually a way for your body to raise a little red flag and say, I need help. So let's be grateful to the bloating. Let's welcome it into the discussion and let's see what it needs from us.
Welcome to Fempower Health. Georgie here. I am so pleased to bring to you Dr. Edison de Mello. He is a physician and author who wrote the book Bloated: How to Reclaim Your Gut Health and Eat Without Pain. And as he said in the preface of his book, I have seen thousands of patients whose debilitating symptoms have stolen not only their good health, but also their joy of eating, playing, living, and even making love. They represent more than 50% of my practice, and he has truly transformed the lives of so many people, including Lee Daniels, the writer, producer, and director who wrote a foreword to the book. And I'm confident that once you listen to this episode, you will feel as inspired as I did to reclaim your health. So let's just dive right in and hear what Dr. de Mello has to say in this amazing, heartwarming, and informative conversation. I'm really excited to talk about bloating. Recently, there was a young lady posting on TikTok. She was changing all of her outfits and was showing the clips of all of her outfits. And then she was like dancing around and she's drinking this green juice. And she says, I saw an influencer on social media talking about this green juice and I feel really bloated today, but I'm about to go out. So I'm going to drink the green juice. And as someone who's been interviewing all these experts, my brain is like, no, we have to start with, why are you bloated? The green juice might not help. And so when I saw your book, I'm like, we have to discuss this. I have endometriosis and I've become really embedded into endometriosis community. And what's interesting on social media is there's a lot of discussion about endo belly. And then there's all sorts of other things about health being discussed. And in reading your book, it was so interesting because I'm like, some of these, it seems like people still don't fully understand. But what I thought we should first do is define what is bloating.
So, the best way is to differentiate bloating that is related to a functional of your system, something that you did that led to bloating that is more a medical condition. Medical meaning more of an urgent condition, right? So bloating, the way I talk in the book, is a bloating that results from something that you have eaten or something that you have drunk, and then and suddenly you feel that your body is reacting, that your belly feels like a balloon. And that kind of bloating comes and goes. It feels very uncomfortable. There's not much you can do. It feels very gassy. You feel uncomfortable. Eventually, if you don't eat for several hours, that bloating diminishes. It doesn't go away 100% because that bloating is a function of your microbiome being out of balance. And the microbiome is this array of bacteria in your gut that helps you to break down the foods. So bacteria is, I wrote a paper one time that said bacteria, friend or foe, right? Because bacteria is incredibly needed for everything that we do, like from the beautiful, delicious cheese that we eat, to the wine that people like to drink, to our hair, to our skin. Bacteria is essential for our everyday life. But bacteria can also kill you, right? So what's the difference? The difference is balance. It's feeling really balanced and understanding that the bacteria, when it overgrows, it's giving a message to your body that says something is off. Please look at it. And that it's not necessarily the enemy. I actually think of it as an opportunity for us to kind of take a step back and and ask ourselves a question: what is my body telling me? So that's the functional bloating that I talked about in the book. It's bloating that is related to either food that you ate, drink that you had, too much sugar, sometimes too much processed food, an balanced meal that is not really appropriately balanced with carbohydrate, veggies, and protein. So that's the bloating that we are addressed later on. The other bloating, Somebody comes in and I take a look at them and I say, "How long have you been bloated?" And they say, "I've been bloated for about 3 months, and nothing I do will go away." And I asked them, "Do you wake up bloated?" And they said, "Yes." "Do you go to bed bloated?" And they said, "Yes." "Does the bloating come and go during the day?" And they said, "No, it's always consistent." So now my mind is thinking there's something else that is happening in her body that is not necessarily a function of the food.
Right.
It may, right? Maybe somebody has a lot of fluid in the gut, secondary to hormonal issues, for instance, that women retain water. Recently, I had a patient come in, unfortunately, with what she thought was she had a problem with bloating. She had read the book. It turned out that she had ovarian cancer. The bloating had to do with ovarian cancer. And how did I defer that when she first came in? By focusing on those questions. She woke up bloated every day. Nothing that she did made it go away. Nothing that she did made it worse. So I said, we need to get an ultrasound, and we went to the ultrasound that there was. So that's the first step. Differentiate bloating from a functional result. Functioning meaning it's a function of something that we're doing that our bodies do not like.
Okay.
Versus more of a medical urgency, something that your body is doing that says, there's too much water here, there's too much gas here, let's go take care of it.
So here's a question. This might be overly simplistic, but especially for those who have the consistent bloating, how do you know if it's being overweight versus bloating? Like, is that easy to tell?
Yes, it is. It is actually. That's an excellent question again, Georgie. You look at the whole body habitus of the person.
Okay.
If I have a patient who is bloated and I look at her arms or his arm and they're not increased in weight, so to speak, or fat, right? I look at the legs, they're appropriate to the person's size, but it's mostly in her belly, on his belly. That's abdominal bloating. That's the girth, the abdominal girth that is increased. Now, when I look at a person who is perhaps more bloated in the belly, but everything is swollen, so to speak, or everything is increase in weight, that's more of a function of weight gain and not necessarily gastrointestinal bloating alone.
What would you say are some of the common myths around bloating that you've seen, or maybe even misunderstandings that you've seen with your patients?
Um, well, I don't know if there's a misunderstanding or more of a function of how they feel. A lot of it is shame,
Okay.
a lot of shame. And when you add shame to the equation, it becomes really hard for us to be able to eliminate the bloating because you cannot eliminate the bloating until you get to the shame,
Right.
right? So, especially women, fortunately and not surprisingly, there's a lot of pressure in women in this country, in the world, to conform to specific body type. And we don't conform to that, there's something wrong with you, there's something off with you. I think we as humans don't understand that people have different body shapes, body habitus. Ethnically, we are different, and the ethnicity leads to different body habitus. And so when we try to conform to the standard American way or European way, and if we don't fit into that, specific for women, as I said, there's a lot of shame. And I think that's really hard for anybody who's interested, who's in that space of helping people with bloating, to help them eliminate the bloating or to address it by bypassing the shame. You have to address the shame head on. So that's the first one. The second one is that bloating is something that everybody feels all the time. So what is the big deal? You eat some foods that your body don't like, you get bloated, and it's gonna go away. And so there is the it's more of like a rationalization. It's and when push comes to shove, and I sit with them and I do a little bit of the psychological assessment, it's clear that that's rationalizing the issue. And again, because there is a sense of feeling victimized by the whole thing. because the thing that's when bloating is a function of a lifestyle, unless you change your lifestyle, bloating is always going to be there. And people think that, oh, if I just come to Dr. De Mello, to a practitioner that is in that space, and we address bloating without addressing me, it's going to go away. And so I often say bloating is not the enemy. Bloating is actually a way for your body to raise a little white flag and say, or red flag and say, I need help. So let's be grateful to the bloating. Let's welcome it into the discussion and let's see what it needs from us. Um, so I think that would be the second or third issue. Um, Interesting. The fourth issue is the bloating is more common in women than in men. And so it's more like a women issue. And so when I see men come in and they're bloated or they're complaining their wife is bloated, they say, well, we should just stop eating the way she does. The bloat would go away. But the stop eating is more like you're doing something wrong that is causing that, as opposed to you don't know what food your body is reacting to. So let's have a little compassion here and let's help her understand that it's all about knowledge, that the body has a language, right? And you're a mom of your 7-year-old son now. And when your son and my children were little, they were crying. And in that crying, they were trying to communicate with us. And our job as the caretakers was to interpret that crying and decipher it into what they're trying to tell us. Are they hungry? Are they wet? Is this strange anxiety? And with time, you understand that sometimes the crying pitch means something different. Correct? Well, that's the body. Your body does the same very thing. It's trying to communicate with you. Sometime in our lives, we become the father, the mother to our body, right? We put it to sleep. We feed it. We protect it from being hit by a car. We shower it. So that's the job of a mother. And so at some time in our lives, we become the mother or the father to our bodies. And so as the father and the mother, when the body is communicating with us, either via bloating or any other symptoms, our job is to listen, to step away and say, I'm curious about what my body is trying to tell me. When I ask that question to people, I usually get two answers. One is like, oh, I don't know. Or there's the question, wow, that's very interesting. Yeah, I think it's telling me something and I don't know what it is. And then I take it further. I said, okay, so write a script about it. If you're writing a script, if you're writing a story about this, make something up. What would it say? And usually the first two or three answers is exactly what we need to go with it. That's what I find when I pose the question to them. And so I think it is when we look at bloating as the body really trying to communicate with you because it wants to get better. Mm-hmm. The body and you have something in common, or many things in common. We are the host to this incredible temple, this thing that we don't even think about it, how it does what it does. The idea that you and I can just open our mouth and communicate, and I can hear you and you can hear me, it's incredible. Right. How does that happen? Our vocal cords, the sound, we can hear the little hair ceiling in our ears vibrating so that we can hear each other. I need to get up to go drink water. My body adjusts to the atmospheric pressure so that I won't fall. All of that is the incredible beauty of this body. And so when we understand that, this magic, then we go like, okay, body, I'm curious about what you're trying to tell me about bloating. And when you approach that with that curiosity, with that partnership with your body, the possibility that the answer will come to you easier than otherwise is immense.
In your book, you share so many different patient stories. And I think back to the equivalent that many women talk about. You know, I interview a lot of OBGYNs and pelvic floor experts, and they talk about like women have such shame over like, have they shaved? Do they have a different smell? And with bloating, I feel like it's an even different level of possible embarrassment because you shared examples of like, you know, like deadly smelling gas that someone is passing like all day long or on an airplane. So you provided so many different examples. And I just wanted to bring attention to that because, I think we live in our own bodies. And a lot of times, depending on the thing that we're facing, we go into a corner and think it's only us. And I always like to start with painting a picture for people of like, no, this is actually quite common, and a lot of people are suffering in silence. And if they don't believe us, then they should read your book and read the stories, because you shared a lot of you had the the husband who didn't think he had a problem and finally listened to you and then felt amazing. The
Yeah.
person on the plane that cleared the plane because of their passing gas. So all the different versions are there, the kids, you name it. So I appreciated you sharing that, because I mean, okay, fine, it's okay to feel icky about it, but this is why doctors like you exist, because you genuinely want to help. But it's not like one
Yeah.
person in the world is dealing with this. There's actually quite a bit.
Yeah, and it is. I mentioned in the book, and I'm sensitive of using this word endemic, because we're dealing with a very very difficult to crack pandemic, and so I don't use that lightly. But I do see bloating as another, as endemic.
Hmm.
Because why is that? I mean, we first of all, we are overly populated. We know this, right? We have what, close to 8 billion people on the planet right now, 7.5 billion, right? Our food sources are less organic than ever before. We are mass producing food. We are bringing food from different corners of the world before they're ready to be picked. We're picking those fruits and vegetables. So there's not a sense that we are working with nature. In some ways, we are working against nature, and we are putting that stuff in our bodies. And so there is the sense that people are kind of lost in this, and the shame is huge, especially, and I don't see this lightly, with a lot of compassion. I have a 25-year-old daughter, and I watch her navigate the world as a very smart young woman, having to deal with the isms of the world as a woman. And if a man gets bloated, is bloated, they look at him differently. Oh, this
Yes.
guy's probably so tired, working so hard, probably doesn't have any time to eat. Poor guy. If a woman is bloating, there's something wrong with her. Maybe she's lazy. Maybe she's not taking care of herself. Doesn't really care about her body.
Yeah.
And so the way men and women are treated in medicine and in bloating is really ugly, and it needs to change. In the book, Georgie, I give that example of the woman who came into the hospital when I was an attending physician, and I brought her as she agreed to come in to help me train the residents. And there was a resident who I chose to name Paul, who first assumed that she's pregnant.
Yep. I remember that.
Right? I mean, this is what people deal with, women deal with. And then never, never asked her anything else that was not related to pregnancy. It was like, you must be pregnant, right? She's a little overweight. She has a belly. She comes in, well, you must be pregnant. And in that, there's a judgment, right? Almost like a judgment that it's like, oh, this is pregnancy. Why are you here? Why are you complaining about? You got pregnant. And that's what a lot of my patients come in with this history of not being seen. They
Yeah.
are not seen, right? One of the things that I talk in the book about is like my goal as a physician, as a trainer of physicians, as an attending physician, is to teach people to meet their patients before they meet their diseases.
I love that quote in the book, by the way. I love that quote.
Thank you. If they don't meet the patient, Paul didn't meet my patient.
Right.
He met her body, and he had a judgment. A judgment meaning you must be pregnant, so why are you here, right? And so I think that's what we need to break away from, is the idea that let's stop victimizing people, let's stop judging people, even when we have our own feelings about it. But let's stop projecting. This is not my story. my story doesn't have to match hers or his. Let me be curious about what's her story, right? What is it that led to this particular moment in time of bloating, and
Right.
how what is it that I can do? 3 steps that I can take in this visit to help her first be seen,
Right.
second to feel better.
Right. You know, it's interesting because on the one hand, it's so simple, right? On the other hand, it's not. So, your book has so much information about different testing that can be done, different causes, supplements, types of food. And even as you said, like, don't just, read this book and take every single supplement off the shelf, take it, and your bloating will be gone. You even say go to someone who is an expert. And I'm glad you put that in there, by the way, because I was that fertility patient. I would read the book. Oh, so I need to take that. Okay, and I'd read the other book. Oh, and take these other 5 things. And it was like the breakfast bowl of supplements every morning. It was a nightmare. So I'm glad you put that caveat in there that you need the advice of an expert. But again, people can read the details and nuances, but is this really as simple as optimizing our gut health? And that's really it. And it just manifests in different ways. So there's like a lot of nuances in the way this imbalance in our gut tends to manifest. And so I don't know if there's any comments you want to share there, because I guess I'm just thinking I'm a patient. I've got this bloating, and let's say I'm mentally prepared to actually address it. Because a lot of us are shame or don't want to see the doctor or don't want to come to face the facts that we're dealing with this. Like, how would I even know where to begin to start addressing it? And maybe what are some mistakes people make early along their journey?
Okay. Um, well, we asked a very, very interesting question in the beginning of this segment when you said, "Is it that simple as just changing a
Right.
lifestyle?"
Right.
I wish I could say yes. It is that
Darn
simple,
it.
but it's
I
not.
tried. I tried. I did. I thought we were going to save the world in 5 minutes.
I know, I know. Me too. I wish I had a magic wand because people suffer from this. It's not as simple, and it's totally attainable. So
Okay.
that's the thing that I want your audience to take home. It's not simple. It requires commitment beyond what you think you have been able to commit to before.
Okay.
Remember, you're committing to your child, your body, and this is gonna sound a little corny, but it's true. Your body is your firstborn. You're born. You become the mother to your body, and so
Yep.
you need to take care of your body first before you take care of anybody. That's why when you get in an airplane, they tell you to put a mask on you first. Why is that? It has nothing to do with spirituality. I want to help people and be a good Samaritan. It has to do with physiological needs. Without oxygen, you'll pass out. If you pass out, you cannot help people. That's what it is. It's a physiological need. But I tell you, Georgie, you and your audience, after almost 30 years of doing this, it is attainable. I've seen it. I've seen people write about it. People become coaches about it. All what it takes is, first of all, is for you to step away from thinking that there's something wrong with you. That's the first step, because the universe it's pretty manageable, it's pretty malleable to what you're thinking, right? If you get up in the morning and you say, "Oh God, it's going to be a horrible day," okay, it's going to be a horrible day, and everything conspires around you to make sure that your belief system is correct.
Right.
If you get up in the morning and you say, "I don't know what the day is going to be like. The world is a bit crazy, but I'm going to make my best out of it, and I'm going to have a good time." Okay. So this so-called universe, which is an energy around you, says yes to everything that you're thinking. And so the point is, let's look at your thinking pattern. What do you think about this disease, right? You're not at ease. What's the first step here? What is it in your life that may be contributing to bloating, right? First of all, you are what you eat. So it is true, but not the only truth. So you are what you eat. So let's look at your diet. Let's look at your lifestyle. Let's look at your thinking. What you think this bloating is here for. And not that you have to be philosophical about it and go into this psychological journey, but say if bloating had a purpose in your life, what would that be? And you'll be surprised, especially with because people are so there's so much expectations that when you reach a certain age, you should have accomplished this, you should have accomplished that, you should have this many children or not this many children. So there's all those things that become subconscious. So when I asked my patients, my female patients specifically, middle aged, and said, okay, so if bloating had a purpose in your life, crazy question, right? But let's just go there. If bloating had a purpose in your life, what would that be? And they usually sometimes they kind of take a step back, look at me like, okay, is this guy for real here? Bloating have a purpose? I said, yeah, let's look at that. Oh, bloating is give me, my marriage is not working. I don't want to have any intimacy. It's keeping that, it's making that easy. It's like, honey, I have the headache. Honey, I'm bloated. And so it's not just stop eating those bad foods and everything's going to go away. It involves more of your gut feelings. Now remember, your gastrointestinal system is the second largest system in your body. Your skin, the second largest organ in your body. Your skin being the first one. The definition of an organ is that it absorbs and excretes, right? That's your skin. You put something that absorbs and you sweat it out. So it absorbs and excretes. And the skin is the largest organ. The second largest organ is your gut. The average human has anywhere from 30 to 40 feet of gut. Here's the thing about the gut. The gut is like that, except that each coil, each different term has a function. It has enzymes that's being released. It has a metabolic function. So when you look at the gut, because it's so connected to your brain, when you're hungry, the brain needs food, gives a message to the gut, and the brain says to the gut, prepare for landing.
Yep.
Right? Which means that you release digestive enzyme, hydrochloric acid, which gives you the so-called, hunger pains. It's a beautiful process. It's called the gut-brain axis. And so it gives this message there, and your brain prepares for eating, and it releases all those enzymes. We all clear without that. Well, how does a gut respond when you're sad, when you're upset, when you're depressed, when you're anxious? The same way. It sends a message down to the gut that produces the feel-good hormone, the serotonin, is now, receiving this message from the brain, and it's discombobulated. It's out of balance. So the brain is to the gut what your heart is to your feelings, right? It's this disconnection. That's why in English, and I love the English language. I speak a couple of languages because it's being a Germanic language, it's very well defined. So when we say that the English language, in my experience, is one of the languages that has the most connotation to the gut, is that to the gastrointestinal system. We say things, for example, what's your gut feeling? Right? Or we say things like, I'm so nervous. I feel like I have butterflies in my stomach. When we have pain, somebody hurts us. God, I feel like somebody knocked in my stomach. So neuro-linguistically speaking, the gut and your feelings are very, very connected. And so that's why I say to my patients, let's take care of the bloating, look at the foods, doing stool testing, looking at what you're ingesting. But let's not forget your feelings. We don't have to do psychotherapy here, but let's at least address them. It's like when you put down on paper, I'm feeling ashamed of my bloating and it's kept me from dating. That is out in the world. You didn't say to the world, but you got it out of your body. So it's like when we're feeling upset and you cry, you feel better. Mm-hmm. It's the same thing. So in going back to the question, is bloating as simple as stop eating? Now you know why it's not.
Right.
But it's not impossible. In fact, it's very possible that one can really resolve bloating and put that behind you and always have the memory of bloating was because you learned how to connect with your body in a different way.
Right.
Does this make sense?
Yeah, no, it definitely makes sense. And, It was interesting when I was reading your book. I guess one of the things that I was really curious about, because you talked about things like the SIBO test, like the breath test and the FODMAP diet and all of these different things. And it's surprising to me that yes, there are a lot of things like ovarian cancer. There isn't a diagnostic test, but the SIBO test, like that's a very clear, it's an actual test that will tell you something. But I got the sense that some of these diagnostics to help with root cause aren't necessarily being done, and it's leading to a delayed understanding of the root cause. Is that something that you're seeing? And if so, why do you think that is?
Yeah, another excellent question, Georgie. Yeah, it's a sad reality that some of my colleagues out there simply do not believe in SIBO.
Oh, that's why.
Oh
Okay.
yeah, a lot of SIBO is presents. A lot of SIBO is more common in women than men. And she's being hysterical. She's being too emotional. She needs to lose weight. She needs to stop eating the bad foods. It's people are stuck into the IBS lingo, right? The inflammatory bowel syndrome. But what IBS describe, it's not the root cause; it's the symptoms. If you think about it, IBS describes the symptoms. It doesn't tell you how you got it.
Right.
Well, SIBO does. It stands for small intestinal bacteria overgrowth. What is small intestinal bacteria overgrowth? What's growing inside of you, the bacteria overgrowth, is part of your normal flora in most cases. It just overgrew. No different than what happens to your beautiful lawn if you don't mow it. It's going to keep growing, 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 and it's going to obscure the whole thing. Now, in your gut, when it keeps growing, those bacteria keeps growing, it leads your immune system into overreaction, right? It's overactive. It's reacting about this bacteria that is causing all these conditions that of which bloating, gas, feeling abdominal pain is part of it. But because it's a relatively not new, but it's not as it hasn't been around as a definition as long as IBS has. A lot of people don't believe in it. It's and so
Really?
yeah,
I guess I've heard about it so much that I did not even know that that was the case. So then you were saying that IBS is a symptom. So then,
it's a set of symptoms.
set of symptoms, I should say. You're right, set of symptoms. So is all of this just gut health? And
Yes,
everyone's using different terminology and it
yeah,
manifests in different ways. I
yeah,
mean,
yeah.
like I just did again, I did the interview on acne. I'm listening to you and I'm like, do we need to like change all of medicine structure and like have like a gut health clinic? And then you have
Yes,
like the spokes of like, okay,
yeah.
here's the dietitian and
You bring out another very interesting point. About 4 years ago, I think, I wrote a chapter in a book of Andrew Weil. Andrew Weil is the father or the grandfather now of integrative medicine. And he has a series of books that he puts out every 3 to 4 years called the Integrative Medicine series. And the one
okay.
that he did last was on addiction. And I was invited to write on food addiction as it relates to the gut. What became clear that I needed to write about there, the microbiome is such a powerful organ-like system that we should stop making it part of GI tract alone and see it as part of GI tract, but also its own individual organ, kind of the lungs, right? The lungs are connected to your heart. It's called the cardiopulmonary system. But we also can talk about the lungs and the heart separately. And so, in the research that I did, Georgia, what became clear was that we need to look at the microbiome. The microbiome is the agglomeration of all the good bacteria and the bad bacteria that's working for one single purpose to help you digest your food. We've never seen a microbiome. Most of us have not, but most of us have seen a beehive. And if you look at a beehive, you're looking at an analogy of the microbiome, right? So let's break it apart. The beehive, thousands and thousands of bees working with one single goal, and that goal is to make honey. What does it need? Well, it needs pollination, good food. Well, the microbiome needs good food. It needs water. Well, the microbiome needs water. You cannot be using a lot of pesticides, right? In a beehive, you're going to kill. Well, don't put a lot of antibiotics in your gut. Don't put a
Right.
lot of processed food in your gut. Don't put a lot of junk in your gut because you're going to kill your beehive in your gut, right? And most importantly, it needs a beekeeper that knows how to take care of that bee by not poking it, by staying away. So the beehive to nature what the microbiome is to us.
Yeah, that's a great analogy.
And so with that in mind, I think you're right. I think what happens out there is that, and some of my colleagues who may be hearing this, I wanted to apologize ahead of time. I'm not criticizing anybody. I'm making this is my own feelings, my observation, colleagues. But I think a lot of doctors, when they don't know about what's happening, they tend to ignore it and blame the patient. Oh, that doesn't exist. Instead of saying, well, interesting. I'm curious about that. You know what? I don't have a lot of knowledge about that. Let's look for somebody who has. We don't do that. There's a lot of ego in medicine, as you probably can attest in your interviews. And so I think the problem lies in that there's a lot of pressure in doctors that we need to know everything, right? And when you feel that, when you embrace that pressure from society, from patients, from yourself, then you don't give yourself a chance to say, you know what, I don't know about this. It
Right.
sounds like there's such a movement towards this. So many people are talking about it. There are tests about it. Other than saying, oh, it doesn't exist, let me say, I'm going to learn about this, or I'm going to say to the patient, I'm not the right person to answer that question. Let's find somebody. But
Right.
that involves having to let go of your ego, and that can be hard.
No. It's interesting. When I did interview that IBS expert out of the UK, we talked a lot about the gut microbiome and stool testing. And he said something so interesting. He says, not in my lifetime. He's older. He said, probably in his 80s. He said, not in my lifetime, but it's going to get to the point where, just like you get your basic blood work at your annual physical, they're going to take a stool sample and they're going to call you up and they're going to say, these are the three bacteria that are out of balance, or I don't know, whatever your report comes back, it'll say these are the exact strains of probiotics that you should be taking to restore your gut health. And he's like, that's the future of medicine. I mean, granted, that is assuming you're not also eating a cheeseburger for breakfast, lunch, and dinner. Let's clarify
Exactly,
that.
exactly. And George, it's
But
already here. That kind of approach that the doctor in England took in explaining to you is so right on. It's already here. There's a lot of research being done
yes,
connecting the genetic composition of each of those bacteria and how it relates to you. And COVID is really advancing our understanding of the genetic component of viruses, of bacteria, because that's what we needed to do to understand it. So more than ever, this approach that this physician in England shared with you, I say it's already here. Is it widely popular or available to patients? No, but more and more we have tests like GI map. We do our right? You've heard of it, so or you're familiar with it. So we do GI map, we stick kind of bacteria there is in there, or it's another test that we use called the Genova test. We do the Genova test, which helps us evaluate your microbiome.
so, do these tests evaluate and give you? Because what he was saying is, right now we're in a state where there's a lot of tests, but then do people always know what to do with it?
No,
Okay,
no,
yeah,
he is
that's what he was
absolutely
saying.
correct.
Yeah,
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 yeah. Some of us, myself included, we have learned how to take care of it by trial and error. I've read a lot about it. I've done, created programs like a reset program that reset your microbiome, that resets your lifestyle. And then I step back and I say, for instance, everybody talks about fiber, 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 fiber. Fiber is not always, most of the time, it's not good when treating SIBO,
Yep.
right? And so but where is this? Now we have a lot of research doing that. But in the beginning, when I was doing this some 20 years ago, before this was even popular, um, there was nowhere to go, you know? And when I wrote my doctorate dissertation in 1996, I wrote a doctorate dissertation called Gut Feelings,
Mm-hmm.
Psychosocial Factors in Gastrointestinal Disease. My doctorate committee barely accepted that was a valid research for me to present.
Wow.
This is 1996. This is not 50 years ago. I had to really convince them that there was something here that I wanted to pursue and to study. And my chair at the time, brilliant man, but couldn't think outside the box. The fact that I was saying, look, in our language, we say gut feelings. Let's look at this feeling. You know, it's like, oh, that's just a term that we use. It doesn't mean anything.
Yeah. And look at where we are now. Imagine where we'll be in like, another 20, 30 years. It's going to be unbelievable.
It's exciting when I look at what's coming next is that you're going to use your thumb or any finger, put on a little electrode, and the computer is going to show your DNA and what medications, foods, or viruses or genetic disease you're prone to.
That's going to be amazing because you're right. It is all like, even in your book, when you talked about what is going to work for you for the bloating, I mean, it's still, a bit of trial and error. Like there's certain things that are probably fairly consistent. I think the obvious ones of, not going to McDonald's for every meal. But it is a lot of trial and error. And I can see in this quick fix society how people may get frustrated. Like I'm thinking back to your question of what do you think your gut is telling you? Even though I fully know that we have to take the time and assess, and I've done my own through my fertility journey and other things, even I was like, what do you mean? What do you mean? What is my bloating trying to tell me? I don't want to talk about that. I need my prescription.
Exactly, exactly. And I love your honesty, and it can only help your listeners by you using your own personal experience as you coach them in a way through this. Um, but you're right. I mean, we all want a quick fix. It's our culture, it's the American culture. We are a very immediate culture. We are a culture of immediate gratification, right? We want it, and we want it yesterday. Right? And to say when somebody comes to me and says, "Okay, I'm bloated. I read your book. Okay, tell me what I can do to be less bloated." And I said, "Well, I can help you be less bloated, but we're gonna have to do some, a little investigation here. Look at what your body's telling you. Look at the foods that you're eating. Look at your lifestyle. Do you sit eating that? Do you eat sitting down, standing up? Do you drink with a straw? What is the purpose of bloating in your life? Do you like yourself right now?"
Yep.
When I ask those questions, eventually they will either stay really connected with me or they'll say, "This is not for me."
Earlier today, I was talking to a client, and I equate that because by day I'm a consultant for the industry, and they're like trying to rush through something. And I was like, hold on a minute. And I kind of equate this to what happens with our health journey. It's like the upfront is painful. So I was like, guys, I know you want to just check and say you got it done. But I promise you, if you don't take like a week or two to just think through everything and plan it out, on the back end, you're going to waste millions of dollars and never get it done anyways. So take a couple weeks, because I found even in my own health journey, like I now know the triggers, and it takes me like a couple days to recover. But I now know, okay, so if I want to feel great because I have something to do, then I know not to eat it. And it's very clear, black and white, I'm resolved and I'm healed. But I do think this quick fix, it's so quick that it almost probably makes things worse in the long run.
It does, yeah. Again, it does because you're not solving the problem. You are sweeping under the rug, and when it comes back, bacteria are very smart. Bacteria creates a film around them. It's called the the microfilm, the biofilm. They protect themselves. They go hiding. They go in hibernation.
Yep.
So unless you take the time, like you said in your analogy with your business consulting, you take the time to really understand what's happening and collect data like you did. You collect data. That's not to be ashamed of, to feel guilty. That's to be celebrated. Wow, look, I learned something. And when you tell people to collect data about their health, and they do that, it's phenomenal. I often use, if you know this, a quote from Thomas Edison, and I'm paraphrasing this whole thing, but the gist of it is that somebody asked him, "So, you try to create the light bulb 1,100 times and you failed. What did it take for you to stay on and to stay so committed?" And he said, quote, "Failed? I never failed. I was collecting data." And that's what I share with my patients often. I don't, when people come in and say, "Okay, Dr. D, you asked me to stay away from, sugar. It was my son's birthday and I had friends over. I not only had a slice of it, but I overdid it." And I said, "Okay, what's the data that you collected?" That's wonderful because now you are well informed.
Yeah.
The idea about this whole thing about bloating is the idea to commit to yourself, like I said, judgment free, committed, stop judging, and realizing that it's a process and you're going to
Yeah.
collect data. If you commit to yourself, if you stop the red tape that judges you all the time, if you treat yourself like you would treat your son who was sick, then you're halfway there.
Exactly. No, I love that. So, with the menstrual cycle, we know that as women, our hormones change throughout our menstrual cycle. And as a result, different things happen with our body. And so, you know, when is it that we would say, for those of us who may bloat at certain times throughout our menstrual cycle, is it, if it's a consistent type of body change, is it fine and we just let it be? And when does it become something where we should see a doctor about?
Again, great question. So most women, or a great majority of women, will feel bloated during the menstrual cycle because they're retaining water. As you know, estrogen is a retaining water kind of hormone, or that allows for water to be retained. So I would say that if you don't have a significant history of bloating, and you're bloating during your ovulation, you hit that 14 day, you're ovulating, you feel bloated, I would say talk to your doctor, talk to your practitioner about how to feel comfortable in that bloating. But it's likely not a measure or not a symptom of that you are bloating because it's a functional issue with your gut. If, however, your bloating continues on and it's more accentuated during your menstrual cycle, then you do have a bloating issue that gets more severe, that gets worse during your menstrual cycle, which is often happen, right? Women either are not bloating at all for most of the month, and then during those 5 to 7 days, they feel horrible, they feel bloated. I say a lot of support, a lot of trying to minimize the implication, the uncomfortableness, but I don't think it is a gastrointestinal issue. I think it's more of a hormonal issue, which
Okay.
sometimes can be addressed, by the way. Women don't have to feel extremely bloated during menstrual cycle. That's not a normal state of being a menstruating woman. The bloating during menstrual cycle should never be severe. If it's severe, we need to look at hormonal metabolism. There are women, however, who are prone to bloating. They're prone to bloating, and during the menstrual cycle, it gets really severe. And that's when we have to say, okay, let's go take care of the bloating because the menstrual cycle is only making it worse, but it's not what's causing it.
Okay, that makes sense. Thank you. And then the next one is the endo belly, which I brought up at the very beginning and might have mentioned a couple times. So this is something I didn't really know about until it was posted on social media. So those with endometriosis, they will often just look pregnant, and I don't know if it's a made up thing, if it's a coincidence that it's folks with endometriosis. I don't know if you've heard patients
I have.
talking about it. I also know that there seems to be this discussion between the endometriosis and IBS community
Yes.
of, is it IBS, is it endo? And so I am now polling. I'm now gathering data because I'm talking to a few experts who are covering nuances around this space to get all the different perspectives. So I'd love to get your perspective on this endo belly that so many have been talking about.
Okay. So there is a connection between endometriosis and IBS in that the symptoms are very, very identical. It's very easy to find out which one is it. With endometriosis, you can get an ultrasound and you can look for the lining of your uterus and you can see how thick it is, how thin it is. And so that will say, if you look at the patient's uterus, and the lining of the uterus is normal, if there is no masses in there, then it's likely more of SIBO than endometriosis. What they refer to endobelly has to do with inflammation. And both IBS and endometriosis, endobelly, one of the common denominator is inflammation. You're inflamed. But why do you bloat when you have an endometriosis? The same way that if you cut your hand, you'll notice the next day it's puffed. It puffed out because the body is so smart. Water runs to the part of the inflammation for two things: to squash out the inflammation and hopefully to wash it off. So when you have endometriosis, by definition, it's an inflammatory condition which is going to lead the patient to retain water because she is inflamed. And so that's why what they refer to endobelly, meaning the belly that looks pregnant, because you are retaining fluid in there, you are inflamed, and with that inflammation comes bloating. And so, what to treat? First of all, decide which one is it. I would do a SIBO test, right? Do the breast test or the SIBO test, see if it's negative or positive. Or if you don't even want to do the test, talk to your gynecologist and say, can we differentiate if this is bloating because of IBS or SIBO, or if it's bloating because of endometriosis through an ultrasound? Most women who have endometriosis already have an ultrasound because that's how we identify it, we diagnose
Right.
it.
It's funny. I used to get it very consistently, and it's kind of gone away. But I'm not even going to try to say what I do because I don't want people to think, oh, Georgie said this. Just like that person, I'm going to drink the green juice before I go to my party, and I'm going to not feel bloated.
But here's the thing: why you go away, Georgie? It's go away because you were eating a non-inflammatory diet.
Yeah.
And so that's the name of the game for every inflammatory-like condition, which is most of our conditions, right? We die because our cells get inflamed. Maybe the cardiac cells, the kidney cells, the lung cells, no matter where it is, they get inflamed, and that inflammation leads to cell death. What's the condition that links all medical conditions? What is the common denominator? Inflammation. You sneeze because your body's trying to make sure that you don't get inflamed. You have cancer because you're inflamed. So look at the two extremes, and the common denominator in there is inflammation. So by eating an anti-inflammatory diet, you're only helping strengthen your immune system. When you don't cheat or when you don't allow yourself to be somewhat flexible once in a while, you are not really being true to yourself. This is part of the human suit. We love pleasure, and most importantly, collect data so that you can use it as an information to your system. So yeah, be human, be loving to yourself, be the best parent to your body you can be, and allow life to just lead you through this incredible journey, you know?
And 90% of the time, eat an anti-inflammatory diet.
I would say, you're right. I would say 98%. I'll be a little
98,
strict. 98%.
Okay, 98. But I will say, like, when I read Lee Daniels' forward to your book and I saw your lovely quotes, I was like, I cannot wait to meet Dr. de Mello. So thank you so much for making time. This was such a great discussion. And for anyone who wants all the details, I mean, it's all in your book. I wanted this to be more of an overlay. I didn't want to repeat what's in your book because it's very easy to go through and very clear to give people guidance to empower them in those conversations with their healthcare providers. So thank you for that. Check out the book and check out my link in the show notes for all the information that we discussed. So thank you so much.
Such a pleasure to be part of this incredible conversation. Thank you for having me.